Gonzalo Perez Salguero, Western Governors University, dental fear presentation. Are you afraid? Heartbeat's rising, temperature is increasing, palms are sweating. Add to these butterflies to your stomach, nervousness, desperation, sweating that's inevitable. All of this are symptoms and feelings that one experiences when facing a disliked event. We're all afraid of something, and in dentistry it is no different. Fear is an issue that dentists and individuals have in common as an issue. Dentists have a higher number of cancellations in their offices because the patients are afraid, and patients go through pain and all their dental issues because they're afraid to see the dentist. Dental fear and anxiety is the main reason individuals avoid dental visits, which ultimately leads to costly future treatments and poor health. What is dental fear? What causes dental fear? What are the effects of dental fear and what can be done about it? These are some of the questions that we will answer throughout this presentation. What is dental fear? Fear. We're all afraid. It's a monster. It's something that we all have to struggle and deal with. In dentistry, as it is defined in dentalfear.com, is the irrational feeling an individual has when facing a disliked event. In dentistry, there are three types. We have dental anxiety, dental fear, and dental phobia. Dental anxiety is the fear to the unknown. When we don't know what procedure we're going to deal with, that's when we have dental anxiety. Dental fear is to the known. It is the fear to the known. If you've had a root canal before and you've had pain, then you will know what you're expecting. So next time you have a root canal, you will have that dental fear. Dental phobia, it is the same as dental fear, only a lot stronger. And many people can build up to that point. So that is what we are dealing with when we talk about fears in dentistry. Now, what are some of the signs that we can look for to see if we are afraid? Number one, do you make your own appointments? Do you find yourself seeing the dentist more than once or twice a year? These are things that, if you consider, you can count them as signs of dental fear. Now, what are the causes of dental fear? What are the effects? How does fear begin? Well, let's think back psychologically. Fear can come from previous experiences. So history of pain equate to a high expectation of pain in the future. So if you have pain before at the dental office, you will expect to have pain at your next visit. Now, sometimes the sound of the drill, sometimes the feeling of being injected with Novocaine can cause and trigger those fears. Age is another factor in fear. We develop fear at very early stages in life, so we can carry those throughout the years. Negative thoughts, word of mouth. If somebody tells you that they experienced pain, they will affect your thinking, and you will have negative thoughts about that. So, fear. What are the effects? Well, fear will lead to avoidance. Avoidance will lead to pain and also poor health, ultimately costing you a lot of money. If you avoid a dentist because of fear, and if you have pain, well, you will end up needing from a cavity to a root canal, to a root canal to a crown, from a crown to losing the tooth to a bridge, and dentures, ultimately costing you a lot of money. Not only that, but now it is said to it is believed through research that gingivitis or any periodontal disease is linked directly to the heart, to heart disease. So it is very important to keep in mind that all of the fear has consequences when it comes to dentistry. Okay? Now, what are some of the things that dentists have been trying to do, and psychologists and people in the medical field have been trying to do to avoid these things? What are some of the solutions? What can be done about it? Well, dentistry has evolved. There's definitely new equipment, better upgraded equipment that we can use in dentistry that helps you be more relaxed. The chairs are more comfortable. There are TVs in the rooms. So all this to take your mind away from things. Relaxation techniques. Little yoga, a little meditation right before your appointment will help you decrease the level of fear and anxiety. Education. There are a number of pills that a dentist can prescribe for you right before your appointment, so you can get more relaxed and take away that fear. Communication is very important. The dentist and patients have open communication. Be very trusting, so that these monsters can be defeated. All of that will lead to less fear. Now we've covered what dental fear is, what causes it, what are the effects, and what can be done about it. There's no doubt that we need to keep in mind that fear and anxiety, it is the main reason why patients avoid dental appointments, which leads them to poor health and future costly treatments. If we take care of this, we should be able to minimize all of that. Yes?
So what does it look like for a patient to be healthy with their teeth?
Keeping regular appointments every 6 months, and make sure that any cavities that arises are dealt with and taken care of. So if you visit your dentist more than once a year, you should be fine.